Hello and welcome back again. So now we have a panel discussion. So we're going to be talking about nurse safety, wellbeing and mental health during and after COVID-19. So we're going to be discussing themes like how implementing flexible working solutions can help reduce staff burnout and keeping staff healthy and motivated at work. Basically, there's quite a lot to talk about. Once again, like all of our sessions, please get your questions in. You can submit them while people are talking and we'll pick them up, or you can submit them later on, entirely up to you. So a big welcome to our panel. They are Jennifer Gardner, Assistant Director from NHS Employers, Chris Caldwell, Director of Nursing at the Tavistock and Portman NHS Foundation Trust, Sharon Aldridge Bent, Programme Manager from the Queen's Nursing Institute, and Claudette Smart, who is Operations and Project Lead at Project 5 and also from the Laura Hyde Foundation. So basically, they're going to be speaking to us in a minute, after which we'll have time for those questions. So please get ready. So first of all, I'd like to welcome Jennifer to speak first, please. Welcome, Jennifer.
Thank you, and thanks very much for inviting me to come and talk to you today. What an exciting day for you all, and it's lovely to hear the fabulous work that everybody's doing. As has been said, I'm Jennifer Gardner. I'm Assistant Director at NHS Employers, working for the NHS across England, and our aim is to be the authoritative voice of workforce leaders and HR. I specifically lead on programmes relating to staff experience, which includes wellbeing, engagement, retention and flexible working. So firstly, I want to acknowledge the current environment that we find ourselves in, as Ruth has just talked about. So COVID has put the health and care workforce under unprecedented pressure, some of the implications of which will be felt for a long time, particularly around the mental health and wellbeing of our workforce. It's also laid bare and exacerbated long-standing problems faced by nurses and midwives, including inequalities, how work's delivered, the increasing pressure that everybody's experiencing, and the need for us to increase our workforce capacity and supply routes, again, as Ruth has just talked about. Nurses and midwives and our workforce overall are essential to the NHS. We can't provide any kind of patient care without them. So the workforce is our most essential asset. And COVID has absolutely reinforced the need for us to be really clear, transparent, funded, to create a sustainable workforce for the future. So for me, what the pandemic has done is highlighted the exceptional personal resilience and commitment of staff that continues to enable the health and care system to cope. It's also presented a real opportunity for us to do things differently, so break down barriers, embrace positive change that's happened, and continue to deliver the best contribution that you can in the face of all of that. And there's some absolutely fantastic examples across the NHS and the wider system of how employers have implemented initiatives, provided support, looked at new processes, for example, risk assessments and the work that was done to really get to the bottom of what needed to happen quickly to have that real safe impact on our staff and ensure our staff are safe. For a long time in the work that we do to support employers, we have talked about dealing with the root cause of issues and focusing on those primary interventions and really addressing the workplace factors. The pandemic again has really stripped back this and highlighted the need to ensure the basic needs of the workforce are met in order for people to keep going. So people getting drinks, people getting breaks, people having food, people having space to just stop for 5 minutes with the pressure that everybody's facing has just been phenomenal. So the pressures we felt before COVID, and often staff describe the pressure of being unable to take breaks before. But what the pandemic has done is really reinforce the need, or also the need for us to provide permission for these elements to be prioritised. So we've seen some excellent examples from NHS organisations of work that's been done in these areas. Some include Sheffield Teaching Hospital, who have provided more trauma support They cancelled non-essential meetings to provide headspace for staff, and who introduced, like many others, calm rooms or wobble rooms, somewhere for staff to go to just have some space for 5 minutes to regroup and to talk to somebody if they need to. And also we've seen the fantastic offer from NHS EI in terms of support to enhance that support that's available as well. We've also seen some amazing flexible working approaches around implementing different types of working from home arrangements to keep staff safe. And what's really important here is that the narrative and the approaches has enabled staff to keep delivering the roles that they want to do, but making sure that they're safe. So looking at flexible working, looking at predictable working, and how we can really make a change in these areas. An excellent example is from Cornwall, who appointed a flexible working lead, and they literally went into each area and spoke to staff about what they needed in terms of flexible working, and developed bespoke plans that really enabled them to embed a flexible working approach and retain their staff. We've also got Birmingham Women's and Children's Hospital, who developed, who undertook a pilot with the aim of improving nursing work-life balance through implementing team-based rostering, which was really successful, and there was a noticeable shift in culture, making it a lot more acceptable for people to ask about flexible working for any reason. Where flexible working is starting to work well, there's a focus on people doing things differently. It's about respecting and honouring individual people and allowing them to have whatever working pattern will enable them to deliver and contribute to the role that they really love and enjoy. What remains critical with all of this is compassionate leadership, and as a culture, and that the culture reinforces this in terms of supply and well-being and the need to build on this as well. And so in organisations where this works really well, there's some key elements that's always there, and these include listening to staff. So asking staff what they want, what would make their staff experience better, tailoring the approach. So there is no one size fits all. I'd love to be able to say there's a magic wand that will fix all of this. But we need to look at the data. We need to really make sure that we're responding to that and we're offering what our staff need. Having clear, simple policies and processes really, really helps. Having support for our line managers is absolutely critical to enable them to support their staff. And communication is absolutely critical. Staff can only access support if they know what's available. And also what's really powerful is hearing those stories about how staff have done that and the impact that that's had. Collaboration with staff side organisations, minority groups across the system, all really critical to make sure that we're listening to everybody's voice and we know what will make a difference to all our staff. And evaluating and having the bravery to stop if things aren't working, but actually also just trying things as well. And as the pandemic has shown, you never know where something will lead. So after the loss and trauma that many of us have experienced and our staff have experienced, the message from leaders and clinicians and our nursing staff is absolutely clear. We must build on the progress that we've made and reset the NHS. We must continue to put staff first, and we must share what's worked well and keep making those improvements. So recognising, rebuilding and resetting. And as NHS employers, we'll continue to work very closely and share good practice and provide any support that we can in this area as well. So that's everything from me. Thank you very much.
Fantastic. Thank you very much, Jennifer. Really, really great stuff in there. Covered all sorts of ground that I was going to ask about afterwards. So that's brilliant. So up next, can we go to Chris, please?
Thanks very much, Steve, and good morning, everybody. It's a real privilege to be here, and I really wanted to start by echoing Ruth's thanks and appreciation for all that you've done, seen and unseen over the last year, and to congratulate those of you who've been shortlisted for awards. My name is Chris Caldwell, and I want to share with you some thoughts this morning based on my work both at the Tavistock and Portman NHS Foundation Trust, and also through 5 years of leading a nursing workforce programme across London called Capital Nurse. And then more recently from my work, my role over the last few weeks only as the chief nurses in our local integrated care system in North London, where there's a population of 1.8 million and 80,000 people work in health and care. But yet we were one of the first parts of the system hit by the COVID pandemic, and since March, well over 1,000 people have died in our population alone, including a number of our staff. So much of what I'm going to say is really consistent with what Jennifer has said. There is no magic bullet, but there's lots of things we can do if we work together. For many people, the pandemic has been terrible and it's been a life-changing experience, but it's also shed a light on safety, well-being and mental health across the workforce in a way that we haven't had before. And it's really, really great to hear Ruth talking about how that's going to be sustained. So it's really important that we make sure that continues into the future. The Tavistock Clinic where I work has 100 years of experience of working in work-related stress and trauma. We began working with veterans from the First World War who came back with what was known as shell shock, and we used talking therapies to work with them, and we've carried on with that work ever since. We're now working with colleagues across our ICS through something called NCL in Mind to support our staff from all sectors, all settings, all roles to be able to cope with their experience of working during pandemic. My colleague Claire Shaw, who I think is in the audience, uses the analogy of ships on the stormy sea, talking about nurses' mental health and well-being. And she's been, this is a conversation we've had well before the pandemic, but also during it. So we're all on the same sea, but we might be in different ships. And I think that this is a helpful analogy. Nursing and midwifery are emotionally challenging roles, and it's inevitable that our work gets under our skins. Everybody should have the opportunity to process the impact of that work as part of the work and to be able to help us to keep going with the work. How we respond to what might seem like the same situation can vary radically based on the unique set of circumstances surrounding each and every one of us. The storm is the same, but what contains us can make the difference between us feeling that we're thriving or that we're sinking. Across London, through Capital Nurse, we've taken a person-centred approach to addressing recruitment, retention and attractiveness, and we're also doing this through Capital Midwife too. We continually ask the question, what matters to me? What matters to you? What matters to all of us? And it's crucial that we take collective action collaboratively on interventions to respond, acknowledging that the responses will change over time and circumstances. In addition, my experience suggests that we also need to attend to the range of needs identified systemically and concurrently. Sustainable solutions lie with the system as a whole, not with individuals, although they must play their part as part of that system. Michael West and colleagues at the King's Fund summarised the needs that must be met for nurses and midwives to thrive at work in their recent report for the RCM, which I think is really relevant to what we're experiencing at the moment. The report's called The Courage of Kindness. If you haven't read it, I would really recommend it. He talks about the ABC, autonomy, the need to have control over our working lives and to be able to act consistently with our values, belonging, the need to be connected to be cared for, to care for others around us at work and to feel valued, respected and supported, and contribution, the need to experience effectiveness in what we do and deliver valued outcomes. West and colleagues identified 8 areas where action is needed. These are authority, empowerment and influence, justice and fairness, work conditions and work schedules, so shift patterns, rest and flexibility, team working, culture and leadership, and workload. Management and supervision, the importance of reflection, mentorship and supervision to enable people to thrive at work, and education, learning and development, flexible, high quality development opportunities. If you've worked in nursing for any length of time, these findings will very much resonate with your experience over all of that time and will be very welcomed. We know enough about what is and what this leads to in terms of nurses and midwives leaving the NHS and the profession. What's vital now is that systemic and sustained action does follow this time. For me, the key to this is through four things: a long needed and systemic focus to address equality and diversity, and I know that that the event is going to look at this later on. Co-producing the future with the nurses who'll be part of the future. Making the issue of nurses' well-being and mental health other people's business too. If nursing is a national treasure, the nation needs to take its responsibility for treating it in a way that ensures that it can shine in its full glory and safekeeping it. We as nurses also have a stake in sustaining nursing and midwifery and for helping each other. How we've done this in London through Capital Nurse is through working together, acting collectively and collaboratively, not in competition. Using interventions like flexibility in working to improve wellbeing and mental health is hard. We have in many places, though, gone a long way during the pandemic to achieve this. Through flexible working, being kind and supportive and caring of each other. Let's not stop now. We might not be able to calm the sea, but we can ensure that our nurses have a safe container to travel in and that they have a joyous journey on the way. Thank you.
Brilliant. Thank you very much, Chris. Again, really things that resonate there, I'm sure, with everybody. Right, okay, so our next speaker is Sharon from the Q&I. Welcome, Sharon. Oh, not sure we can hear you, Sharon, actually. Hang on a second. You're not muted or anything funny, are you? No. How's it doing now? No, still can't hear you, Sharon. Let's just check with the technical team. Everything all right? Okay. Definitely not muted. I know it's an obvious one. No. Okay. Okay, in that case, we'll come back to you in a minute, Sharon, when the team has had a chance to find out what's going on. So, sorry, Claudette, we'll move on to you, and if you're ready to go.
Hello, can you hear me?
We can, yep.
Excellent. Okay, so my name is Claudette Smart, and I'm from Project 5, which is it's a support service for NHS people, anybody in the NHS basically. We were set up as a consequence of COVID basically. I guess one of the things that is important, and it's really interesting listening to all the sort of different sort of perspectives and people working from the inside the organisation, but I guess I bring a perspective from outside of the NHS and how we've sort of tried to support things. You know, it is recognised, you know, we know that wellbeing is a problem, and it's been lovely to hear how other people are experiencing that and talking about that as well. The Laura Hyde Foundation, who we have been working alongside, you know, have been really trying to champion support for nurses and the recognition of mental health challenges that people can experience around sort of work. We've also done our own sort of exploration. So, the government reported already concerns prior to COVID in 2017 in their Thriving at Work report that, that there were real challenges around supporting and, well-being of staff and increasing levels of burnout and anxiety. And then this was revised in 2019, and it was noted that it still had not been tackled. Since then, COVID has brought further increases in anxiety and uncertainty. So we were born as Project 5 in a moment of wanting to help, basically. We are clinical psychologists, we are coaches, we are nurses who have come together to offer the support that we can. When we were seeing, I guess, in the news and from our colleagues that it was increasing challenge, and that this may not be able to be supported. A lot of our clinical psychology colleagues were being redeployed, for example. So we had over 4,000 volunteers who wanted to help and support, and we had to develop a complex screening process and accreditation process, because actually we realized that you can't just let anybody loose. And so we very rapidly, within just a couple of months, developed an accreditation process. We screened people and have a training process, which is based on solution-focused short-term intervention that is designed to help people to work during times of challenge by building on strengths. So actually the focus is not so much people who are already traumatized. It's how we can support people and improve their relationship with work, so that they don't always get to that point. Obviously, we have some trained mental health professionals as well, but we are also really keen to provide solutions and enable people to improve their relationship earlier on, in order to kind of do that. And we've developed a tiered service. We have support for self-help support on our website, etc. as well. We also link in with a very complex clinical governance process and clinical governance committee, which includes partnering with NHS England and representation from NHS England, as well as service leads. So there's a lot of, there's years of experience people who've dealt with other concerns such as SARS, etc. in the past. We are currently supporting, we have capacity currently to support, to provide 4,000 sessions per month, but the uptake is not as high as we'd like it to be. It's an interesting question that I'd like to raise for the panel around uptake. We support doctors. Approximately 22% of people who come in are doctors, 25% are nurses. So that is the largest group of people who are supporting, and at different levels. So 29% are junior, 56% are of senior level. So people access us because they find it easy, but also because it is outside of the NHS. So we include people who've worked previously in occupational health. And one of the challenges that people discuss is that they may go for support with a psychologist or somebody, and then they may have to meet that person in the corridor later on, having disclosed things that perhaps we don't want to talk about in public. So Project 5 provides that kind of opportunity to talk to somebody who is totally independent from the NHS. We don't, we have no individual reporting. We just give generic information like this. Top reasons that people come to us are anxiety or depression, work stress or feeling overwhelmed by COVID, seeing more deaths than normal, for example, isolation or loneliness, lack of managerial support, bullying, harassment. Some people have lost confidence a little bit. They've been redeployed into different areas. They feel like they're being overextended. We also, they feel like their expectations are beyond their level of experience. And then there's a smaller number of people around the work-life balance challenges. Perhaps that's because of some of the increasing interventions elsewhere and the personal, and some people with personal kind of sides. What do they get out of it? I have some quotes. People say things like, she helped me understand what was happening in my brain, why I ended up where I was, and has given me the tools to get me back on top. She was fantastic, kind, patient, and very helpful. I didn't feel embarrassed or silly about anything. She made me feel like I was strong, but also worthy of spending the time I needed to focus on my own well-being. I mean, that seems to have been our major challenge, is that people, they help other people, but it's really difficult to bring them back to helping themselves. The challenges that we have faced include access. How do we get people to access? How do we communicate? Somebody already mentioned comms, and I think that that is a really, really significant issue. We have challenges around funding, long-term sustainability, and the question whether this is, you know, how long this kind of support is required, it's voluntary, etc. What are the future solutions? Well, we've been doing our own sort of research, and actually it looks like, you know, we also have been thinking about systemic approaches. So we provide just a small opportunity for people to think about solutions, but of course that needs to be part of a whole culture change in terms of accepting that it is okay. You don't need to feel guilty if you want to access support. So thank you for listening. I hope that that's really helpful, and I hope that fits somehow into the wider discussion.
Great, thank you, Claudette. Great to have that external perspective. Right, okay, Sharon, we'll go back to you. Thank you very much.
Thank you, Steve. Can you hear me now?
Perfectly, excellent, thank you.
Lovely, thank you. So, hello everyone, my name's Sharon Aldridge-Bent and I'm the Director of Nursing Programmes from the Queen's Nursing Institute, and we're a registered nursing charity dedicated to improving nursing care of people in their own homes and communities. So that's anyone working in district nursing, general practice nursing, care homes, learning disabilities, community children's nursing, inclusion health, health visiting and school nursing. And I think my session is really about supporting this group of nurses and acknowledging them during the pandemic as being nurses that have on occasion visited people and gone into homes when others haven't, right through the pandemic. The Queen's Nursing Institute have supported them in many ways via education. We have an information hub on our website for all things COVID related to community nursing in particular, and we've developed many resources to support community nursing practice during this time, and also for nurses being redeployed into different settings. I also really wanted to talk about our education as well in terms of post-pandemic, which is going to invite a different type of leadership going forward, and we've really recognised that in terms of how do you hold your nerve, how do you cope with what's happened and what's going to be happening going forward, and how do you support your staff, and how do you support an environment that is going to be different to the environments that you've worked with before. So we've thought about these things and we're developing programs to support nurses going forward. We also have a policy influence arm of the organisation, and we've been working very closely with our long arm bodies to support nurses during the pandemic. I personally have been running a care home nurse network, which has got a Facebook page, and I'd encourage any nurses working in care homes to join that page, where we've had scrutiny of all the guidance that's been coming out over the pandemic, and some of it on Friday afternoon, very, very short notice. Really, nurses clarifying, talking to one another, ensuring that they get this thing right. The other thing that the Q&I have been really responsive to is the impact that the virus is having on our BAME colleagues and our BAME staff. And we've developed an inclusion review that has just taken place with some actions around it. I can't stress this enough. I really do think going forward that we're going to have to think about a very different way of supporting our BAME staff and thinking about how they practice. Really, really important for us too. Other areas that I'd just like to talk about is our listening service, which was developed during the pandemic. Again, this is one opportunity for any registered nurse working in the community or primary care to download and speak to somebody around what's happening for them at that moment, at that time. It's not a counselling service. It really is a listening service for people to offload, get that opportunity. We will encourage people to access additional support if needed. But I've been a listener during COVID, and I can say it's probably been one of the most profound things that I've ever done throughout my nursing career, to really listen to the challenges and the issues and the dilemmas that nurses are facing. Nurses that want to be able to look after their patients, their residents, but also feeling guilty because they've also got to look after home and everything that's going on at home. And sometimes it's just been an opportunity for people to say, I've had enough. And all I've done is talk through with them some of their options. I'm not giving them any answers because there aren't any answers. But what I've tried to do is to support them emotionally whilst they're going through these terrible times. What I would say is that I think that whilst things have been so terrible, there have also been so many opportunities. I think that coming out the other side of the pandemic, I think we're going to really be working beyond institutional boundaries, beyond institutional services, and we're going to be working in a very different way. And I think that's something for us to really embrace. So in one way, I think it's been awful, but we've moved mountains in 9 months. It feels like that. I know that we're close to time, so I'm going to stop there, and I'll be happy for any questions. Thank you very much.
Great, thank you very much, Sharon. Absolutely, some great points in there, which I'm sure will chime with everybody. As I said, get your questions coming in. I will start off with a few. So going back to Jennifer at the beginning, you mentioned various things like wobble rooms and all these other things that trusts have been trying to introduce, which we've been championing through our Are You OK campaign as well. Have there been any particular things that have impressed you and that you think that NHS employers will be encouraging trusts to keep doing, basically as a sort of a legacy of the pandemic?
Gosh, it's a difficult question because, as we said earlier, there's so much. And the thing for me is there is no one size fits all. So what's working well for one person might, you might need to have a different approach for somebody else. So the example that Claudette shared there, some people want to go locally and get support. Some people want to go and utilise the national support that's available or other options. But the bottom line for me, I think, is just keeping on saying to staff, how are you and what could we do to make things better for you? Because from that, you will get the answers, and that will enable us then to have some really effective and supportive processes in place to support staff going forward. And that will keep changing. So just keep having that conversation.
Yeah, no, great advice there. And just turning to you, Chris, as well. You sort of mentioned some things are sort of around a similar kind of frame, really. You picked up on the flexible working, which I thought was quite interesting. But again, you pointed out I suppose it's easier said than done, particularly with nursing and healthcare. How do we get flexible working ingrained, do you think?
I think it's really hard, Steve, as you say, and it requires us to let go of some of the things that we've held on to so tightly in nursing and midwifery in terms of our hierarchies and controls and our kind of and the systems and processes that have just they have we've brought them with us for historically for many years, and we're looking at a future where those kind of things just, those kind of controls and regimented systems just won't work not for the people that we're attracting into nursing and not for the way that we need to work in the future as well. So, but it's really hard. And I think what's really fascinating is everybody wants flexible working when you talk to them, but then when they're in the position of being asked for it, they find it very difficult to offer. So it's really interesting. So, I remember once being in a conversation where I had final year student nurses with nurses who were very experienced nurses in their final third, say, of their career. And the more experienced nurses were talking about how they might stay longer and they might not retire if they could work in a different way, if they could work more flexibly and part-time and so on and so forth. But then when the student nurses were talking to them about the kind of roles they wanted to have when they qualified, they found that very, very difficult to kind of, so if a student nurse was saying, actually, I'd like to work a bit of the time in this setting, and then I'd like to work a bit of the time in this setting, or I'd like to work 9 months of the year so that I could have the summer off and go traveling or whatever, and they found that really hard. And I think we've just got to just keep thinking, actually, what would I want and how can I offer that to somebody else? And that might mean some really different solutions. But actually, we've got great digital technology now through some of our rostering technology. It works really well in other industries, and there's no reason why we can't adopt it in nursing. And that's not just in hospitals, in all settings. I'm responsible for the COVID vaccine programme workforce in my sector, and we're going to be using digital rostering to roster people from all sorts of organisations, and it'll be really interesting to see how that works and how we can apply that afterwards.
Yeah, definitely. Yeah, very, very exciting with the vaccine and how that's going to work in terms of workforce. So yeah, thank you, Chris. Claudette, we had a question in for you, in fact, from Lisa Williams, which I'm sure is quite an easy one to answer. She just asks whether your support services are open to the independent sector and nurses working in private sector as well as the NHS, I think was her question. And also, just for me to follow up on that, obviously the charity sector's got a very important part to play in here. Sharon might want to pick up on this as well. But I suppose there's that feeling, perhaps, feel wrongly, that nurses and health professionals just carry on and don't ask for help when perhaps they should. Would that be something you'd agree with? And basically, how do we get them to ask for help? We put these support services there, but how do we encourage them to use them?
Yeah, so first of all, the question about who can access, I mean, that's currently, it is currently NHS employed services, but we are discussing the possibility of extending that at the moment into social care, but also potentially into we are actively discussing how it might work in terms of the private sector as well. So and then, sorry, your second question was about, yes, access. Yeah, this is a discussion that comes up quite frequently, and there's kind of been elements of it, I think, spoken about by both Jenny and Chris, actually. So from our perspective, we've been thinking about this in terms of the systemic ways in which we work. So people work as part of an organisation, and they are part of a culture. So I was quite interested. That's why I was sort of quite interested in this sort of notion of community and how we change that. What was already impressive, actually, this morning was in Ruth May's presentation. She gave permission for people to access. As a healthcare leader, she herself said that she had thought about her own well-being. So one of the things that we have been thinking about is actually that is really important, leading by example. I do a lot of work, or I've done a lot of research in multidisciplinary teams and interprofessional care, and it's the same. It's interesting. We kind of focus on students as for students to learn, yeah, and of course that's important because of course they are the future, yeah. But there is less focus actually on interprofessional working. There's actually less focus on how we do professionalism, and I think the same in the well-being context. So I think that what's important is that as leaders and as managers and as senior managers, we also show other people and are able to give people examples of how we have considered and looked after our own well-being in such a way as to give permission for others to do the same thing and not to be guilty. In one place that I worked, I remember there was a very long discourse around overwork, we're too tired, we're exhausted, we've always got so much to do, and that had to be the focus. A new manager came in and he left it 5. This was a, you know, it was a outpatient thing, but he left at 5 and he expected everybody else to do the same thing, and he arrived at 9. And, you know, so he kind of led by example, and actually the generic well-being of the team changed. So that would be, so you know, we are there to try and help people rethink their relationship with work, to improve the way that they are able to relate to their own work, etc. But I think that there is a wider systemic issue here, and you know, we'd love to work alongside or happy to consult around that. But yeah.
Great, thank you. So Sharon, obviously sort of similar, I suppose, in terms of people accessing, nurses accessing the help that the Q&I has got on offer. And also, as a second part, I guess, community nurses obviously have been out there working, you know, doing amazing work. There's obviously been a lot of focus on hospitals, powerful images in the news and things. Has the community had enough attention, do you think? Often people working alone, and the pressure that brings.
I think to echo what Claudette has just said about sense checking and really checking the mood of people around you. So if you've got people that you're working with that are carrying on regardless, because nurses are historic and they just keep going regardless. Sometimes it's about a colleague having a word with you and saying, do you know what, I think it's time for you to take a bit of time out, because how productive are you once you get to the point where you become so overwhelmed with everything that's going on? And certainly from our networks, what we're picking up at the moment is that the mood is pretty low, energies are low, and people are thinking, can I go again? And that's the time really I'm encouraging people to talk to someone and to really have a word with yourself and say, am I okay? If I'm not okay, who can I access? Certainly. Mm-hmm. As far as whether or not I think community nurses always get enough attention around what's been going on, possibly. I'd like to say that I think that there's more than one front line, and just to remind people that front lines happen across communities and across organisations. And certainly I would say that community nurses working in adult social care are working on their own front lines and have been sustaining patients and residents at home for a very long time during this pandemic. And I'm always going to raise the flag for community nurses working in those areas, most definitely.
Fantastic, thank you. So we've got a couple of minutes left. So basically, I'm going to come to each of you in turn just to give a sort of a quick 30 seconds, basically, just to try and answer well, basically, I'm going to ask you what you'd like the audience to take away from this session. But also within that, Dion Daniel has asked, how do we continue to focus on well-being beyond the pandemic? So I guess that kind of is the same sort of question, basically. But Jennifer, if I can come to you first, that would be great.
Thank you. Yes. So the thing that I would say really is we quite often previously talk about starting with yourself. So following some of the discussion that's just taken place, you know, make sure that you make time for yourself, that you're checking yourself, that you're looking after your own well-being. I want to expand that a little bit and say, check yourself, start with yourself, but start with your team. So how are you? What do you need? And what does your team need? And what can be done? And if we start there and all look out for each other, we're going to get support and access to things quicker than we would have done before, and which is absolutely fundamental at the moment in terms of keeping everybody safe and well. So that would be sort of my key takeaway, really.
Fantastic, thank you. I'm going to come to you next, please, Chris.
So I'd follow on from that. I'm going to pinch everything you've said, Jennifer. I completely agree with you. But I would also say, and also, don't work together, not just within your team, in your organisation, but across the healthcare system with your colleagues in social care and primary care. Think about the impact of the work on everybody that your patients and service users access. And think about how you might work together across that system to improve their health and well-being and yours at the same time, and make sure that that's plugged into the way that your integrated care system is working and is thinking about its strategy for the future. And certainly, you know, kind of don't compete with each other. work together, and you'll achieve an awful lot, and it'll be much more fun along the way.
Great, wise words. Thanks, Chris. Okay, Claudette, please.
Hi, I guess that I would say I would want people to, everybody, this is about everybody. It's not just about people who think they might have mental health or problems, or colleagues who might have mental health problems. I would want nursing to come together and to focus on your own self-development. I never knew there was such a thing as coaching. You know, it's out there. Take the support that's offered. Look at how you can develop yourself. Think about the ways in which you relate to your own world, and you know, and from there, you know, give yourself the permission to invest in yourself and take up the services that are around you. You know, there's all these things that we've discussed today. So that would be my point. Focus on yourself before it becomes a crisis.
Thank you. And obviously, last but not least, Sharon.
What I'd say is I think COVID-19 has taught us how to think differently and to deliver services differently. And what we need to do is change the narrative in the work culture. And the narrative needs to be around elevating staff health and well-being. That's got to be paramount going forward. And I think if we can do that, and that's the brilliant thing coming out of the pandemic, I think we'd have moved forward in leaps and bounds.
Fantastic. So that's basically all we've got time for. So thanks very much to our panel, Jennifer, Chris, Sharon and Claudette. So thank you very much. And our next session is with Peter Griffiths, who is Chair of Health Services Research, NIHR Senior Investigator at the University of Southampton, on safe and effective staffing. So over to Peter.